Stop for a moment. If your blood sugar keeps climbing even though you're doing everything right, what I'm about to share may either frustrate you deeply or finally set you free. For 24 years as a surgeon, I've watched patients follow every instruction with discipline. They took every pill on time. They cut the foods they loved. They exercised. And still, their numbers kept rising. They blamed themselves. Their doctors blamed disease progression. But the truth is far more uncomfortable. You are not failing. Your doctor is not lying. You're both fighting the wrong enemy. Right now, there's a very high chance your cells are resisting insulin not because of what you ate yesterday, but because of something so basic it has been overlooked for decades. The medical system rarely focuses on it because there's no prescription for it, no procedure, no billing code. Yet I've seen this single adjustment drop fasting glucose by 40 to 50 points in just 2 weeks without changing a single meal. I'm Dr. Megan Foster. I've spent over 2 decades in surgical and clinical practice. What I'm about to explain isn't experimental. It's not trendy. It's simple physiology that never became profitable enough to prioritize. This is the variable that determines whether insulin can even do its job before food or medication enter the picture. And if you've been told your only option is stricter diets or higher doses, that narrative ends here. Here's what's really happening. Blood sugar doesn't rise only because glucose enters your bloodstream. It rises when glucose cannot enter your cells. And one of the fastest ways insulin becomes less effective is cellular dehydration. The same meal, the same medication, the same person can produce completely different blood sugar readings depending on hydration status. That distinction changes everything. This isn't about replacing treatment. It's about restoring the internal environment your treatment depends on. By the end of this series, you'll understand why fasting glucose becomes unpredictable with age, how hydration timing influences insulin sensitivity more than volume alone, why ice-cold water can worsen morning readings, and how a structured hydration plan can stabilize blood sugar without adding one more restriction to your life. Most adults over 65 are chronically dehydrated even if they never feel thirsty. That's measurable. And dehydration quietly makes blood sugar control harder, regardless of diet or medication. Yet hydration timing is barely mentioned in diabetes care. It's treated like optional wellness advice. It isn't optional, it's foundational. As we age, 4 key changes make hydration more difficult. First, cellular water channels called aquaporins become less responsive. These are the gatekeepers that allow water into your cells. When they slow down, hydration becomes inefficient even if you're drinking. Second, kidney filtration declines, making it harder to conserve water. Third, thirst signals weaken and arrive late. By the time you feel thirsty, dehydration has already set in. And fourth, many common blood pressure and diabetes medications increase fluid loss as part of their mechanism. You can be significantly dehydrated without dry mouth or obvious symptoms. The only sign may be rising blood sugar. No one connects to hydration. Here's why that matters. Even mild dehydration stiffens cell membranes. Rigid cells resist insulin. Glucose stays trapped in the bloodstream not because you ate poorly, but because your cells cannot receive it. Insulin is the key. But if the lock is stiff, the key won't turn. I saw this clearly in Mark, age 72. His fasting glucose had been steady in the 120s for years. Then suddenly it climbed into the 180s. No diet change, no missed medication. Just age progression, his doctor said. When we reviewed his habits, he was drinking fewer than 2 glasses of plain water daily. Everything else was coffee or juice. We adjusted only hydration, timing, and temperature. No dietary change. No medication adjustment. Within 2 weeks, his morning readings dropped into the low 130s and stayed there. Same food, same meds, different hydration strategy. Here's the insight I want you to hold on to. Blood sugar instability is often a volume problem, not a food problem. When cells are hydrated, insulin works. When they're not, nothing else matters. And yet most treatment plans focus entirely on what you're eating, never asking whether your cells are prepared to receive what's being delivered. So let me show you the 3 hydration mistakes quietly worsening glucose control every day after 60. The first mistake is counting coffee, tea, or juice as water. Coffee is a diuretic. It pulls fluid out. Juice spikes blood sugar. Tea can be neutral, but it does not replace plain water for cellular hydration. Your cells need actual water, not flavored substitutes. The second mistake is drinking ice-cold water, especially first thing in the morning. Cold water causes vasoconstriction. Your blood vessels tighten. Circulation slows. Glucose uptake becomes less efficient. Room temperature, or slightly warm water, absorbs more effectively and supports insulin sensitivity. The third mistake is waiting until you feel thirsty. By that point, dehydration is already present. You're reacting instead of preventing. These patterns seem small, they're rarely discussed, but they matter. And the solution is what I call the WTR protocol: water quality, timing, and regulation with adaptation. Let's start with water quality. Filtered water is ideal, but clean tap water works. What truly matters are minerals, especially magnesium, potassium, and sodium. Glucose transport is electrical. Insulin signaling is electrical. Without minerals, that signal weakens. A simple pinch of sea salt or trace mineral drops in your water dramatically improves cellular hydration. No expensive systems required. Now, timing. This is where most people get it wrong. It's not just how much you drink. It's when. There are 4 hydration windows that stabilize blood sugar better than random sipping all day. First, immediately upon waking, 12 to 16 ounces of room temperature water. This rehydrates after the overnight fast, reduces cortisol-driven glucose release, and prepares your cells for insulin response. Second, 30 minutes before meals, 8 to 12 ounces. This improves blood flow to digestion, slows carbohydrate absorption, and reduces post-meal spikes. Third, mid-morning and mid-afternoon, about 8 ounces each. This prevents gradual dehydration that leads to afternoon variability. Fourth, 2 to 3 hours after your last meal, 8 ounces. This supports overnight kidney function without disrupting sleep. Same water, different timing, different outcome. Hydrated blood is less viscous. It circulates more efficiently. It delivers insulin more effectively. Dehydration is a stressor, and stress hormones raise blood sugar. Structured hydration lowers that stress response. In the first week, you may urinate more. That's normal. Your body is recalibrating. Within 10 to 14 days, kidneys and cells adapt. Blood sugar variability begins decreasing. Energy stabilizes. Mental clarity improves. Week 1, adjustment. Week 2, reduced variability. Week 3, noticeable fasting improvements. Week 4 and beyond. A 1C changes under medical supervision. Elaine, 75, saw her A1C climb from 7.9 to 8.8 inches 6 months. Insulin was being discussed. She was drinking maybe 1 glass of water daily, relying on diet soda and decaf coffee. We implemented structured hydration with minerals and proper timing. 3 months later, her A1C dropped to 7.4. No new medications, just restoring internal balance. Hydration doesn't replace treatment. It allows treatment to work. There are myths that need clearing. If you're not thirsty, you still need water. Thirst is delayed after 60. Drinking moderate water with meals does not ruin digestion. You cannot get enough hydration from food alone. And the old 8 glasses rule isn't universal. Timing matters more than arbitrary totals. Winter dehydration is often worse than summer. Indoor heating pulls moisture from the air and your body. I see more unstable glucose in January and February than during the holidays. Summer brings sweat and electrolyte loss, making minerals even more essential. George, 73, drank a liter of water right before bed. He woke 3 times nightly, destroying his sleep. Poor sleep spiked morning cortisol and fasting glucose. We redistributed his intake throughout the day and reduced late evening volume. Within 3 weeks, his fasting glucose dropped from the 150s to low 120s. Consistency matters more than occasional spikes. Stable 130 every morning is better than swinging between 90 and 180. Structured hydration creates predictable physiology. Medication timing also interacts with hydration. Diuretics increase fluid loss. If you're on them, spacing hydration is critical. Don't flood your body right after taking a diuretic. Sip gradually. Coffee? You can keep it, but for every cup, add 8 ounces of water beyond your regular windows. and never count coffee toward hydration goals. Early in my career, I underestimated hydration. I focused on complex interventions, but I repeatedly observed better recovery, better wound healing, and better glucose control in well-hydrated patients. The pattern was undeniable. And if you want this to stick, find accountability. A spouse, a friend, support improves consistency. But I must be clear, this is not a cure. Never stop medication without your doctor. Heart failure, kidney disease, dialysis, these require supervision. Watch for swelling or sudden weight gain. Adjust gradually. Now, let's talk about how to track this properly. Tracking is simpler than you think. You don't need an app. You need a notebook. Each day, write the date, check off your 4 hydration windows, and record 3 glucose readings. Fasting, 2 hours after breakfast, and before bed. That's it. After 2 weeks, patterns emerge. You'll see hydration days align with steadier numbers. Those who struggle usually overcomplicate. They buy expensive alkaline systems. They obsess over mineral ratios. They chase perfection. Don't. Filtered or clean tap water works. A pinch of sea salt works. 4 structured windows work. Simple and consistent beats complex and inconsistent every time. If after 3 weeks you see no improvement, check 5 variables: temperature, mineral inclusion, timing accuracy, compensation for coffee and medications, and sleep quality. If those are aligned and nothing changes, consult your physician to evaluate other factors. Long-term, this builds resilience. You tolerate stress better. Occasional indulgences impact you less. Your baseline becomes stable. And this stability influences more than numbers. It affects your family. When your children or grandchildren see you taking structured action and seeing measurable results, you're modeling empowered aging. My challenge is 90 days. That's how long cellular adaptation truly stabilizes. 90 days of 4 hydration windows. 90 days of minerals. 90 days of tracking. I have never seen someone complete 90 consistent days without measurable improvement. Start gradually. Begin with the waking window. 3 days later, add pre-lunch hydration. Then mid-morning. Then afternoon. Then evening. Build steadily. You need clean water, trace minerals or sea salt, a reusable bottle, and a notebook. That's it. Common questions arise. If you miss a window, don't double up. Resume at the next. If you're already drinking a lot, focus on timing and temperature. Severe kidney disease requires supervision. Results usually begin appearing in week 2 or 3. A 1C reflects 3 months of averages, so patience matters. Hydration improves skin elasticity, digestion, sleep, mood, blood pressure stability, and kidney efficiency. These are not side benefits, they're systemic improvements. But beyond physiology, there's emotional weight. Years of unpredictable readings create guilt and exhaustion. Every high number feels personal. Every medication increase feels like failure. You cannot discipline your way out of cellular dehydration. You must correct the environment first. Your body wants to regulate. It cannot function optimally without sufficient cellular hydration. Like a car without oil, all the parts are present, but friction prevents performance. Robert, 68, had fasting glucose in the 160s for years. After implementing the WTR protocol, he dropped into the 130s within a month and the 110s by 3 months. His doctor reduced medication. He cried not because of numbers, but because he realized he wasn't broken. This is not temporary. Hydration becomes foundational. Year 1 stabilizes glucose. Year 2 maintains range. Year 3 may allow supervised medication reduction. Hydration is not glamorous, but it is foundational. So tonight, place a glass of room temperature water with a pinch of sea salt on your nightstand. Drink it upon waking. That is step 1. Now let me show you how medication timing and hydration timing work together. If you take metformin or another glucose-lowering medication in the morning while dehydrated, distribution through the bloodstream becomes less efficient. It's like delivering packages through traffic congestion. Linda, 67, took her medication with coffee only. Her dose kept increasing. We added 16 ounces of water 30 minutes before her medication, and another 8 ounces with it. Within a month, her physician reduced her dosage back to the original level. The medication didn't change. Her hydration status did. Temperature matters too. Morning water should be room temperature or slightly warm. Cold water first thing can trigger stress hormones. Later in the day, mildly cool water is acceptable, especially in warm conditions. Now let's talk about the dawn phenomenon. Between 4 and 8 a.m., your body releases hormones to prepare for waking. These hormones naturally raise blood sugar. When dehydrated, that rise becomes exaggerated because blood is thicker and hormones are more concentrated. Drinking water immediately upon waking interrupts that cycle. Many patients report improved sleep within the first week. Hydration improves sleep. Sleep improves insulin sensitivity. It becomes a reinforcing loop. For those with prediabetes, structured hydration can prevent progression. I've seen fasting glucose in the 110s drop into the 90s within 2 months when hydration aligned with existing lifestyle. Even long-term diabetes responds. Patricia, 71, had unpredictable readings for a year. Tests were normal. The issue? She avoided water during the day to prevent bathroom breaks and drank heavily after 6 p.m. She was dehydrated all day and overhydrated at night, disrupting sleep. We front-loaded her hydration earlier. Within 3 weeks, her variability stabilized. Kidneys require water to filter effectively. Dehydration reduces their ability to clear excess glucose. Proper hydration supports filtration and balance. Exercise also depends on hydration. If dehydrated before activity, stress hormones may spike glucose instead of lowering it. Drink 8 to 12 ounces 30 minutes before exercise and again afterward. Cost concerns? Trace minerals cost a few dollars per month. A basic filter is inexpensive. Compared to medication increases or complications, this is minimal investment. Set phone reminders initially. After 2 weeks, your body anticipates hydration windows. If plain water feels boring, add fresh lemon, cucumber, or mint. Avoid artificial sweeteners. Traveling disrupts hydration easily. Bring a reusable bottle. Fill it after airport security. Keep water accessible in the car. Even 4 days of poor hydration can destabilize readings for weeks. I've seen too many patients blame themselves unnecessarily. You're not out of options. You may simply be missing cellular hydration. Supporting your body works better than fighting it. And sometimes the most powerful change is finally correcting the basics. So here's your 2-week challenge. For 2 weeks, change nothing else. Same meals, same medication, same routine. Add structured hydration only. Follow the 4 windows. Use room temperature water. Add minerals. Track fasting glucose daily. If your numbers improve, you'll see it. If your energy increases, you'll feel it. If brain fog lifts, you'll recognize it. Once you experience that shift, your confidence returns. I'll support you through it. Your body is not your enemy. Insulin resistance is often a biological response to dehydration. Meet the need, and resistance decreases. Hydration is basic. But when timing, temperature, minerals, and consistency align, the impact is profound. You were never failing. You were missing one essential piece, and now you have it. So here is where everything comes together. Not in theory, not in complicated charts, but in action. Tonight, before you go to bed, place a glass of room temperature water on your nightstand. Add a small pinch of sea salt or trace minerals. That single decision sets tomorrow in motion. When you wake up, before coffee, before medication, before breakfast, drink it. Give your body what it has been missing during the overnight fast. Then follow the next hydration window before your first meal. Continue through the day. Steady, structured, intentional. Do not chase perfection. Chase consistency. Over the next 2 weeks, observe. Watch your fasting glucose. Notice your afternoon energy. Pay attention to your sleep. Let the data speak. Let your body respond. Then extend it to 90 days. Because true adaptation takes time. 3 months is what your A1C measures anyway. Give your cells those 90 days to relearn how to function in a properly hydrated environment. And as you do, something powerful happens. The fear around your numbers softens. The unpredictability decreases. The sense of control returns. Not because you restricted more, not because you punished yourself harder, but because you supported your physiology. You stabilize blood sugar by supporting the system, not by attacking it. Your body has been waiting for the right environment. Provide it, and it will respond. So here is my challenge to you. Commit. 2 weeks to begin. 90 days to transform. 4 hydration windows. Room temperature water. Minerals. Tracking. If this message gave you clarity, if it shifted your perspective, if it gave you hope where there was frustration, type approved in the comments so I know this reached you. Share it with someone who needs it. And subscribe for more science-based guidance that empowers you instead of restricting you. Take care of your body. Support it. Trust it. And I'll see you in the next video.